Hi. Okay, I acknowledge this is kind of a different format for you to begin to get prepared to have your results report. It's not very often that you go to a doctor's office and before you come in to get your results, you watch a video. The reason that I do this is because I found that if people really understand how their body works, why their body's doing whatever it's doing, they will get better quicker and stay better longer. And honestly, that's what most people want, and that's what I want for you. So I'm going to begin to share my screen here. And I want you to understand why I did the test that I did and what they all mean. So bear with me on this. Okay. My goal for today is, like I said, to help you understand how your body works, to understand how to create long-lasting healing and adaptability, because that's really what health is. It's your ability, your body's ability to adapt to whatever is going on in your life. Now, most people think of chiropractors as back doctors, or sometimes it's back and neck doctors. But really what we are is we are doctors of the nervous system. We are nerve doctors. And let me just grab my little model here. If you look at this model, this is a model of the spine. Your spinal cord passes right through the back part of your spine and sends out nerves to every part of your body. Every cell, organ, and tissue has a nerve that goes to it. And if your nerve system doesn't function as well as it possibly can, it makes it much harder to grow, heal, and develop properly. Because your nerve system is found in your spine, which is in your back, that's why people think of us as back doctors. But honestly, if your spine was in your arm, we'd be arm doctors. Okay? So I love this picture, and you can, I don't know how well you can see this, but you can just zoom right in and take a look. I think this is kind of a great representation of how the nerve system works. It's a little bit simplistic, but your spine essentially, or your nerve system essentially, it's kind of like the fuse box in your house. So the things that are higher up in your body are going to get their power from the upper part of your nerve system, and the things that are lower down in your body are going to get their power or their innervation from the low part. And the middle part gives power to the middle part. So I'm going to walk you through each part because I really want you to understand how this all works. So as chiropractors, we typically think of the spine in three different areas. The neck or cervical spine is the fancy clinical word. The upper back, where your ribs are, or the thoracic spine, and then the low part, the lumbar spine. You've probably heard that before. So upper, middle, and lower. And those nerves, like I said, they go everywhere. So if you just look at the neck or the cervical spine, those nerves, they give power to all of the muscles in your neck. They go up, they actually go up into your brain, and they help your brain process information. They go to your scalp, your head and your face, your sinuses, eyes, ears, nose, all that. So they will also innervate your thyroid gland, your thymus gland, which is part of your immune system, and your shoulders, arms, and hands. So, okay, we're not in the same room right now. I can't actually ask you this, but I'm going to ask you. You can say it out loud or say it in your head. If somebody had an area of the spine that wasn't moving normally, so the chiropractic word for that is a subluxation. You're going to hear me say that lots and lots through this presentation. If somebody has a subluxation in their neck, so a part of their neck that has stopped moving normally and it's not allowing the brain and the body to communicate normally at that point. If someone has a subluxation in their neck, and now you know where those nerves go, what kind of a symptom might a person with a neck subluxation have? You're probably thinking in your head, headaches or neck pain. Those are sort of the two most common answers that I get, and they're great answers. Yes, 100%. And the reality is that how one person feels it may be very different than how another person feels it. It really depends on which nerve fibers are being affected. So yes, you might get neck pain, but what I care way more about is the fact that those nerves also go to the thyroid gland, and you may not feel that the thyroid isn't functioning normally. What I see when babies, I am a pediatric specialist. I see lots and lots of newborns. I have adjusted kids minutes after they've been born. If a baby has a subluxation in their neck, one of the most common symptoms they're going to get is colic. In a child, we often see chronic ear infections when kids have subluxations in the neck. I'll also see, when kids are just flying around, they've got ADHD, can't focus, they're like really hyper, or, the inattentive kind of ADHD where the kid's not hyperactive, but you ask them to go brush their teeth and they'll do 12 other things on the way to get their teeth brushed, and they'll totally forget to get their teeth brushed. A lot of kids now and young adults, I see headaches, and headaches of different kinds. For me, when I got headaches as a kid, this was before I got adjusted, I would get tension in the back of my neck that would just start to travel forward. But I hear a lot of patients who they know when bad weather is coming in because they get that weather pressure kind of headache. A lot of women around menopause will get migraines, or some of them will stop having migraines once their hormones kind of even out. So you see lots of different things. I used to get, when I was a teenager, I used to get a sinus infection every February, like clockwork. So when we adjust, those are the kinds of things that we can see change. The thoracic spine, so this part where all the ribs are, those nerves, they go to all the muscles of the chest and back. Most common symptom I hear is pain between the shoulder blades. So that tight upper back where you feel like you're just always wishing you had a tennis ball that somebody could get in there and do some trigger point therapy with. That is probably the most common thing that I hear when babies have subluxations in their thoracic spine. Again, often there's colic, reflux, those kinds of symptoms. Kids with thoracic spine subluxations are often the kids that have reactive airways, lots of asthma. When people get a cough, it goes right to their chest, that kind of thing. Lots of, when adults have it, especially older adults, what I'll start to see is they need somebody else in the car to help them with their blind spot check. Okay, so yes, we can see those things. What I care way more about when somebody has pain between their shoulder blades, or they're having trouble moving their neck, or they're feeling lots of shoulder pain, is that those nerves also go to the heart, the lungs, the top of the stomach, the esophagus. So a lot of adults will have things like reflux, hiatal hernia, right? Because the nerves that go to the muscles that tighten the ring that stop the stomach acid from flowing upward, they start to weaken when there's a subluxation there for long enough. So we see a lot of that, especially as time goes on in adults. The lumbar spine. You guys have probably heard of sciatica. So the sciatic nerve, I'll just point to this again. It's a huge nerve. This nerve is like the size of my thumb. It is the biggest nerve in the body, and when that nerve is irritated, boy, can you ever feel it. So those nerves, they go to everything kind of the waist and below. But the forward part of the like the front of the thighs, the back of the thighs, the knees, the shins, the calves, the feet. So probably the most common thing when somebody has a subluxation in their lumbar spine is they will get some kind of low back pain and or sciatica, so that radiating pain that goes down. But those nerves also go to the lower part of the digestive system, okay? So the colon, the large and small bowel, the rectum, the reproductive organs, bladder, kidneys. So again, what I care way more about is that those nerves aren't necessarily getting all the information that they're supposed to be getting from the brain, and what can result in that. So in babies, I'll see chronic constipation. When a baby isn't pooping every day, generally there is something that's happened, usually because of the birth process, where those little bones of the spine have stopped moving normally, and the brain wants to tell the bowels how to void themselves, and it's just not happening. In older adults, probably one of the most common things that I hear is people who complain of bloating, right? Because the digestive system just isn't getting the same messages anymore. People who have things like irritable bowel syndrome, ulcerative colitis, they typically have a really unique, common subluxation pattern. When girls have, or women have, really bad menstrual periods, so really painful menstrual periods, or patchy, right? They're skipping, it's not regular, they get 2 in a month, and then they can go months in between. that's an indication that something is going wrong. And then, of course, in older adults, especially older women, what I'll see is starting to have leaky bladder. Again, the muscles and the organs just aren't getting the messages as clearly anymore. And often when we begin to adjust, there's just way more harmony in the body. But at the end of the day, the problem is the same. So it is a subluxation that is wreaking havoc in the body. And one of the coolest things that I learned in chiropractic college is that only 1 out of every 10 nerve fibers in the body actually has the physical hardware to perceive pain, which means that 9 out of 10 times, those nerves, they're for function only. So you can have a problem and not feel it until you feel it. And then it's usually a really big problem. So I think we all know of people who have gone to the doctor and gotten a test result back that was devastating, they weren't expecting. And it's not that the cancer or the Parkinson's or I don't know, whatever it is, just started when they had the test done. It's something that's been developing for years, but the body is so good at covering things up. And if it's not hitting a pain fiber, you won't necessarily ever know it's a problem until it's a really big problem. So I always tell people, pain or dysfunction, the things that you feel, they are the only language that your body has to let you know that something potentially bigger is going on. So when you or your kids have something going on, we typically tend to just hope it goes away, right? Especially if it's in ourselves. A little different with our kids, but probably one of the most common things I hear from people is, well, I thought it would go away. Or as women, we tend to really love to just try and push through, right? I mean, we're used to having pain. We're used to just pushing through things. Symptoms are the way your body will tell you something is happening inside and you need to pay attention to it. And so that's what we do. We're looking at what is the bigger picture here. So how do we test the nerve system? I think we're used to going to the doctor, and when we get a checkup done, they put the stethoscope on your heart and your lungs. They'll check inside your ears. They might check your eyes. They might do some, reflex testing on your knees, but nobody ever actually tests the nervous system. And yet your nerve system runs the show. It is in charge of everything, every thought you have, every behavior you have, every feeling you have, how your body moves, how your body functions. It is the single most important system to test because every other system gets its input from the nerve system. That's what we test in a chiropractic office. So I generally do my tests in 3 different categories: alignment, flexibility, and damage. So when you came in, we did a variety of different tests, and for some people we'll do slightly different versions of tests, but alignment, I'm looking at what does your spine feel like? So when you're lying on the table and I'm palpating or I'm feeling the joints from the top of your neck to the bottom of your pelvis, does it feel to me like things are in proper alignment? We did that posture. So for a lot of you, you will have a posture test done, and I take 2 pictures after you leave. I feed it into a software system, and it helps me to see, are things in proper alignment from a posture standpoint? Are your eyes, shoulders, and hips, are they all level with the floor? When we look at you from the side, does your ear measure right up over your shoulder, or is your head starting to come forward? Because if it is, it tells us there's going to be tension in the nerve system that will not allow your brain and your body to communicate normally anymore. Flexibility is important. So again, when I'm palpating your spine or feeling all the spinal joints, I want to feel this nice springiness, this flexibility in every single joint. When I feel a subluxation, it's like hitting a hard table. I feel like it's kind of like hitting a brick wall. For a lot of you, I would have you squat. I might have you do a sit to stand test. So I'm really looking at how does your body move, and specifically how does each spinal joint move, because I know that the more flexibility you have, the better your body will be able to adapt to all the things that life throws at you. And then the last thing is damage. So I do certain neurological tests. So you may have had grip strength test, the heel to toe test. If those are positive tests, it tells me that there's more damage in the spine than someone who doesn't have a positive test. The x-rays. So if we were able to take x-rays on you, This is a huge one for me because I can actually see inside your spine. I can see, is there wear and tear? Are you losing disc spaces? Are there spurs on the bones that indicate degeneration? So the more deterioration or degeneration you have in your nervous system, the more care it's going to require in order for us to put things back into a sense of balance and harmony. And that probably makes sense, right? If we look at an 8-year-old child versus an 88-year-old adult, chances are, just by virtue of the fact that the 88-year-old has lived a lot more life and had a lot more chance to damage their spines are going to have a lot more deterioration in it. Therefore, it will require more adjustments in order to get them functioning the way they want to be able to function than a child. But the big thing is, especially in a child, if we can catch the damage early, then we can actually prevent a lot of the deterioration that 88-year-old might have now had they never had care. Hope that makes sense to you. Let's talk specifically about x-rays. I mean, I love x-rays, and I will generally x-ray children as soon as they're able to really stand up. Teenagers, young adults, adults, as long as you're not pregnant or breastfeeding or trying to get pregnant, we generally will take an x-ray because I get so much information from them. So I am actually going to walk you through what I'm looking for, but from how do we create care recommendations perspective, basically the milder the problem, the fewer adjustments you need. The more severe the problem, the more adjustments you're going to need in order to create harmony and function in your nerve system. We use numbers. For you guys, I mostly just tell you whether it's kind of a mild, moderate, or severe problem, and then present the findings from there. So let's do 4 years of chiropractic radiology in about 5 minutes or less. Okay, so this view that I'm showing you is a side view of somebody's neck. So this is normal. The next slide I'm going to show you is abnormal so that you can see the difference. When you're in the office, if you've had x-rays done, I'm going to show you your x-rays. So I want you to remember what this looks like and what we're looking for, because I'm basically going to ask you when you come in, I want you to be able to look at your own x-rays and tell me what you see. So when I look at the spine from the side, no matter where I'm looking, whether it's the neck, the mid-back, or the low back, when I look at it from the side, I want to see a C-shaped curve. Let me pull out a spine model here. Hang on. Okay. This is spiny, and if I take spiny from the side, you can see no matter where we're looking, there is a curve. We want to see a curve. When I look at your x-rays from front to back, it should be, spiny is a little subluxated here, it should be nice and straight, okay? So when we look at your side view here, I want to see this nice C-shaped curve. And just so you know, this red sort of hashed line here, this is where the spinal cord would sit. So whenever I'm looking at an x-ray, I am always thinking to myself, what does this mean for the spinal cord? What does this mean for the nerve system? Okay, so when you look at the spine from the side, first thing I want you to notice is there a C-shaped curve? Second thing I want you to notice is, does the bone have good quality? So this is what good quality bone looks like. It's mostly a square shape, mostly kind of a grayish white. This is what normal bone looks like. And the third thing I want you to look at is the discs. So on a spinal x-ray, you can't actually see a disc because it's made of soft tissue. But what we can see is the space. So these black spaces in between the bones, that's where the disc would be. And when you look at yours, I want you to just ask yourself, is the space all consistent? If the spaces are consistent, then we know that the discs are most likely really healthy. Okay, this is not you. This is abnormal, and I'm showing you two different people in two different stages of life. So this is the same view. We're talking about the side view of somebody's neck. If you look at this one here, do you remember the three things that I asked you to look for? First thing is the C-shaped curve. You can see in this one, this person has lost their curve. Their bone is still normal. Their disc spaces are still mostly normal. So in this case, we have the loss of curve, but everything else is normal. That tells me that this person, no matter how old they are now in the process of degeneration. This person is an older version of this person. So you can see here, there's no C-shaped curve. And in fact, in this area, the curve has actually started to reverse itself. So at one point in time, it was a nice C shape like this, and then it went straight. And now in this part, it's starting to reverse and curve the other way. It's a very complicated curve. And it really, really changes function in that area. But chiropractic care is great for this. So if you look at the bones, see the difference between this bone and this bone? See how there's jagged things here? Those are called spurs. And again, it's a sign of degeneration. Right here, we don't have much disc space. So you can see there's a big difference between this disc and these discs here. So this person kind of they have all three factors. You don't have to have all three factors to be in the process of degeneration. Any combination of these. So I've seen people with bones and disc spaces that are really degenerated, but still have a beautiful shaped curve. So any combination of that tells me we are now in the process of degeneration. So when if this person's 22, we're not going to say they have arthritis. Whereas if this person's 82, we'll say they do have arthritis, osteoarthritis. Other words you might hear are degenerative joint disease, degenerative disc disease. It's all the same thing. It's just a description that tells us that the bones are wearing down. But what is the only difference between this one on the left and this one on the right? Time. Just time. And so from my perspective, say this person is 17. Okay, they're not 17, but say this person is 27. And we have this. I want to catch it and be able to correct it and get a more regular pattern of function in this spine so that it never becomes this. If I see this, looking at the person on the right here, if I see this much degeneration in the spine, it's been there a long time, decades. This does not happen overnight. And so again, I know that if it's taken them this many decades to get like this, it doesn't go away in 2-3 adjustments. Never, ever. The body just doesn't work that way. This is normal. So remember I was saying from front to back, I want it to be as straight as my pen. So this is the thoracic spine. These are the ribs that you see here. This is the lumbar spine. Those funny ear-looking things toward the bottom of the x-ray, those are the pelvic bones, and this is the femur bones down here. So again, I just want to see really nice alignment. I want to see that the hips are level and the spine is straight. This is abnormal. This is not you. This is just an abnormal spine so that you understand when you see your own what I'm looking at. Can you see on the one on the left that there is a bend in the spine? This person has a mild scoliosis. That means that the biomechanics of this side of the spine, the right side of the spine, are going to be different than the left side of the spine. It also means I have to change up some of the way I adjust because I don't want to make the curve worse in the way that I adjust it. So getting x-rays is really great. If I see this in a child, we want to make sure that as they go through puberty, if it's a woman, as she goes through pregnancy, so these really high growth periods in her life or their lives, that it is not going to get worse. This person is older, as you can probably imagine. This is a really severe scoliosis. I don't see very many cases of scoliosis like this, but I've certainly had lots of them through my decades-long career here. This person here on the right started with a spine at some point in time like the person on the left, but it wasn't caught, it wasn't prevented in any way, and for whatever reason, their lifestyle, their genetics, it progressed really quickly into a very severe case of scoliosis. Now, again, when you think about, well, where are the nerves going, it probably is not a surprise to you that this person has a lot of digestive problems, and incidentally, this person has had a heart attack, right? These nerves here are going to the heart, and for years they've been compromised. So again, these things are probably not a surprise if I tell you that. Now, let me ask you this question. What if somebody came in and they had no back pain at all, but they have a spine that looks like this one on the left? Do they have a problem? And I know that you're saying yes, because you already understand where the nerves go, right? What if somebody had no symptoms whatsoever, none, no digestive issues, never had a heart attack. They come in, they're just interested in making sure that they stay well. And we take an x-ray and they look like this person on the left or the person on the right. Do they have a problem? You're probably answering yes. Why? Because we know that the nerve system cannot function entirely normally if they have any amount of this going on. So my goal is always prevention, right? If you come in and you have no symptoms, you have no dysfunction, somebody's just told you chiropractic is great for wellness, that's awesome. So first of all, awesome. I wish there were more of you. But if we find anything in your spine, I'm still going to recommend adjustments because I want to make sure that you continue to stay healthy, to feel as well as you feel right now for the rest of your life. Often as I'm going through these cases, people will say to me, like, they're thinking, oh, my daughter was colicky, or, I've got a nephew who's got asthma, for example, or my mother-in-law suffers from reflux all the time. She's always in pain, or, I know somebody who's got headaches, or I know somebody who's got back pain. And that's awesome if you're thinking of other people. People started asking me, this was many, many years ago, can I get my kids checked? Like, if this is happening in me right now, does it make sense that I get my kids checked? Because I want to make sure they never end up the way I am. Yes, 100%. And so what we started was a kids policy where you come into the office and you have kids, we'll check all of your kids at no charge within the next 2 weeks. And then, of course, then the spouses would get upset because it didn't include them. So then we made it a family policy. You can have anybody in your family checked for the next 2 weeks and there's no charge for it. And then people, they weren't necessarily married and didn't have kids, but they had a coworker or their best friend, for example, suffers from terrible periods, or they get migraines, or whatever the case is. And they wanted to know, well, I don't have a husband, but I've got a best friend. Can I get my best friend checked? Yes. So now what we do is we just say, if you know somebody in your life that you think should get checked, and really, I'll just be honest with you, anybody with a spine should get checked, we will check them at no charge for the next 2 weeks. So yes, there's a catch to this because we only have so many appointments and we only have so many staff members available. So what I do is I do say, if you can do it within the next 2 weeks, there's kind of a time limit on it. This doesn't go forever. And we do kind of cap it at about 8 to 10 people, again, only because there's just so many appointments in a day. So, I mean, really, if you've got 15 kids, I will check them all. We'll figure out a way to do it. But if you can sort of limit it to 8 or 10 people and within the next 2 weeks, awesome. And I'm happy to do that. If you know somebody in Calgary, for example, and you're thinking of, I would love for them to get checked, but they're not in Port Perry, no problem. I've got a great colleague in Calgary that I can refer them to. If you've got, I say Calgary, but it doesn't have to be Calgary. If there's somebody you're thinking of from another place, ask me. And if I can find a chiropractor who will honor our offer, and a lot of them do, we'll make sure that we can get them checked. You just need to let me know. So if you're thinking it right now, start writing it down and just make sure you bring it in with you. But I will ask you in your results report if there's anybody that you wanted to get checked. So stabilizing the problem in your nerve system takes a significant amount of time. And I think this concept of time is a really important thing for me to talk about because we are in a have to have it right now period of time. We expect everything quickly. So when people come in, I generally will put them, the first sort of phase of the recommendations that I give them is for correction. So again, my goal is to get you feeling more like yourself again. But my biggest goal is for you to actually stabilize and create wellness in your nerve system, and that takes time. So if most people don't realize that the cells of the nerve system, they are the slowest turnover cells in the body. They take 9 to 12 months. So 6 months from now, you're still going to have a lot of the sick cells or deteriorating cells in your nerve system that you have right now. So for a child, when I give them 12 months, the next 12 months, what this is going to look like, I expect that by the end of 12 months, their spines and nerve systems will generally be stable at that point, and then we move into wellness care. That doesn't mean that it takes you a year to feel better. You're going to feel better way before your spine is stabilized. But if you stop care at that point, you'll probably be good for a while, but then you'll start to see things creep back in again. And as you get older, things creep back in quicker, they last longer, and they're harder to correct. Okay, if you are somebody with a moderate spinal care problem, so a moderate nerve system problem, the stabilization phase is in the range of 12 to 18 months. And if you've got a lot of degeneration in your spine, so if you've got a really severe nerve system problem, we're talking about more like 18 months to 2 years. So I just say that I'm not going to give you a 2-year care plan. I generally will give people 12 months at a time, but I say that so you understand there are phases that you're going to go through and things, the stabilization phase, you probably won't feel the stabilization happening, but what you'll feel is things in your health that you maybe didn't expect. I don't know if you can see the pictures behind me. You probably would have to lean in really close, but they're pictures of patients in the office and they're holding a whiteboard, and in all of their whiteboards, it says things like, headaches gone, low back pain gone, right? They're feeling better, but then what it'll also say is things like better immunity, better digestion, learning is easier, more calm, less anxiety. Those are the things that people notice, the changes in their health over time as a result of the adjustments that they're not necessarily expecting. That is what happens when your nerve system begins to stabilize, and you can really take advantage of what wellness and health truly feel like. So how do you get from where you are to where you'd like to be? There's a couple of things that we do as part of your care, and this is what we'll talk about when we talk one-on-one. So first, always a series of chiropractic adjustments. Everybody gets an adjustment program. You're going to get more at the beginning. Most people will start with 3 times a week, but again, it depends on who you are and what's going on. And then we get there's less and less as time goes on. We begin to sort of taper things off. I just realized. Anyways, we begin to taper things off from there. You will get a series of spine-specific exercises. So do them or don't do them. This is where, the get better, faster, stay better, longer principle comes in. The more you do outside of the office, right? The more you do your exercises, the more you eat well, the more you move lots, the more you focus on reducing your stress, sleeping well, all those things will speed up your healing. So when I give you exercises, they are generally specific to what's going on in your spine. I will tell you exactly what you need to do because there's so much on the internet. It can be overwhelming. People come in with ideas from YouTube and TikTok and Instagram. I'm going to tell you exactly what I want you to do based on what's going on in your spine so you don't have to try and figure it out. Like I said, do them or don't do them. If you tell me that you're going to do them, I will assume as we're going along that you are doing your exercises as I've prescribed them, okay? If you don't do them, again, I'm not going to judge you for that, but if it slows down your progress, that may be why. Spinal orthotics, they're kind of like orthotics in your shoes, but for your spine. Some of you will need them, some of you won't. I'm just going to say that now. If this pertains to you, I'll tell you when we do your one-on-one, but these are things that will help your spine sort of shape or align itself more normally. Not everybody needs them. And the last thing is time, and I have to keep coming back to this concept. Do the right thing and then give it time. Nothing happens quickly in the body, right? We don't put braces on kids and then take them off 2 months later. We take them off 2 years later. Now those teeth will move into their proper alignment long before that. But if you take the braces off too early, the teeth will just start to move back again. Your nerve system takes time to heal. Every time I adjust you, it's like we're undoing a bad neuromuscular pattern and we're showing a brand new one that is better and more adaptive. Every time you walk out the door, your spine is going to try and pull it back to what it knows. So every time I'm adjusting, it's kind of like we're saying, nope, we're doing this. Nope, we're doing this. Nope, we're doing this. And over time, your nerve system will start to go, oh, this is a much better plan. This is a much better habit for me. And then eventually it will hold it and do it on its own. Then we begin the conversation around wellness care. Wellness care is basically how often do you need to come in here? How few times can I see you and you still continue to build health? But that's a conversation for a different video. The biggest goal of chiropractic care for anyone is greater adaptability and resilience for the life that you lead. I know that you want to talk about your symptoms. You want to tell me about how you're feeling, and sometimes I will ask you that. But in my office, we're going to talk a lot about adaptability and resilience, because pain relief or specific malfunction, they're just indicators of a nervous system that can adapt to all the things that life will throw at you, whether it's a horrible emotional breakup, slip and fall on the ice, a motor vehicle accident, whatever it is. A well-functioning nerve system helps you to adapt to all these things quicker. And really, that's what health and longevity is. The people who can adapt the quickest are the ones that will live the longest life with the highest quality of life. My goal for you is that as you get older, you get to build more and more tools into your health toolbox. You'll get healthier and healthier, so you can keep doing all the things that you love and not have to delete things from your life that you love to do because you just can't do them anymore. That sucks. I want you, when you're 80 years old, to still be able to jump off the couch and go have an adventure in your life. That's what I want for all of you. If people are going to have questions or challenges, they typically will fall into 4 categories. Okay, the first one is, does it hurt? And I always say this, about a third of the people that start to get adjusted will feel some stiffness and soreness. A third of them will feel nothing, and a third of them will feel awesome. Which one are you? I don't really know. So in that will it hurt category, just remember that I'm not just realigning the joints and helping the joints move better. All of those joints have ligaments, muscles, and tendons around them. And when we start moving things, the soft tissue sometimes can rebel. So think of it like if you went to the gym, you may feel stiff and sore after a workout. You may get that after an adjustment. I typically find it works itself out within the first 2 weeks, but if you have questions about it, make sure you let me know. The second thing is this the right fit for you? So I will always say, I think from a longevity standpoint, if all you're looking for is, you know what, just give me a couple of adjustments and when the pain goes away, I'm out, I'm not the right girl for you. There are lots of people who do that well, and I mean, I do that well, but that's not my passion. And I think that everybody should be in an office where the doctor is really passionate about the kind of care that they're giving. I want you to feel better as quickly as possible, but I want you to stay with it for the long haul. So most of my patients will figure out some optimization schedule at some point in time where it's a habit, right? Whether they feel bad or whether they feel good, they come in for their adjustment and we make sure that their spine and their nerve system is functioning as well as possible for the rest of their life. Time, how long are the appointments? Okay, so the examination that you had and the report that you're going to have, these are the longest appointments that you're going to have. Typically, the adjustments are really only about 5 minutes. You come in, you lie down on the table. It doesn't take very long to adjust somebody's spine. It really doesn't. We're generally only adjusting in maybe 2 to 4 places. The things that typically take a long time is if people are hooking you up to machines or doing soft tissue work. I leave that to the experts. When you come in, I'm adjusting you. That's my expertise. That's what only chiropractors can do. And we generally have you pre-booked. We sort of know how you're paying ahead of time, so you're not necessarily always stopping at the debit machine or the desk to give a payment. And so they're pretty quick from that point on. Now, days that you have re-examinations, we will give you a heads up, and the adjustment time is maybe about an extra 10 minutes as we do our extra testing. And the fourth is finances. And listen, I'll just say, health is an investment. It's free to be sick in Ontario, but it's an investment to be healthy. And I hope this doesn't sound crass, but you're going to pay it one way or another. You're either going to pay it now through your credit card or debit card, or you're going to pay it later in your health. But we are in a sickness care system that caters to that. And if you have the benefit of benefits, that's awesome. But do not make the mistake of trying to match up your adjustment schedule to your benefit schedule, because it will always steer you wrong. They're throwing you a bone. And so, like I said, if you have it, that's great, because lots of people don't. But don't try and match your care to your benefits. It's not going to work in the long term. As far as how do you pay, we have different options. So some people will prepay. We give them a discount. Like if you want to pay the whole thing at once, we'll give you a discount for that. If you need to spread the payment over many months, we've got a monthly payment plan. Or lots of people, they leave their credit card in the system, and as soon as you walk out, I hit a button, it charges your credit card, sends you a receipt. But what I always say is, if there are financial challenges, if you have an issue with finances, please just talk to me about it, and I will do whatever I can to make sure that you get the care that you need. Make sense? And yeah, just a reminder that once we go through your results, if there's anybody that you want to get checked after that, you just let me know and we'll make that happen. So the next step is for you to get your results one-on-one. I will see you in the office really soon. And in the meantime, if you have any questions, just text me, email me, call me, but I'm pretty sure I'm going to be able to answer everything when you see your own results. Thank you, and I'll see you soon.